Hello. Thank you for joining us today for Buyer Beware, Open Enrollment of Medicare and Fraud. I'm Gretchen Batra, the AARP Fraud Watch volunteer in the Mountain Region of North Carolina. And I'm really pleased today to have Elaine Deppe joining us. Elaine is a registered nurse and has a master's degree in nursing, but especially relevant for today is that she has been a SHIIP volunteer for 13 years. So she's got a great deal of experience in this topic. But before we begin, if you have comments or questions, please put them in I think you have a chat box over on the right side of your screen. So add those there, and we'll be glad to. Somebody said good morning from Manchester, Missouri. Neat. Okay. Elaine, tell me a little bit more about SHIIP. And is it a national program?
Gretchen, thanks for having us talk with you today. SHIIP are the initials SHIIP, and it stands for Seniors Health Insurance Information Program, at least here in North Carolina, where I am. It offers this program in every state, but it could be called something different. Some other places it's called something different. Sometimes there's only one I, sometimes there's two. SHIIP offers free and unbiased health insurance information counseling, answer questions, help with billing issues. I kind of call us the angel on your shoulder during Medicare. The other program that SHIIP involves is the Senior Medicare Patrol, and they provide education about Medicare error, fraud, things like that. So they work in coordination with you folks and with other organizations. So that's a little bit about SHIIP. We're in every state.
Thank you. So every state has some version of this, and do take advantage of it. So open enrollment for Medicare started October 15th, and it ends December 7th. So I know you're real busy right now with this, Elaine, so thank you for joining us. For those that just started Medicare this year, or those of you who've been on for a long time, it's really necessary and important to take advantage of open enrollment. So tell us why it is so important.
Gretchen, there are times that we can join, switch, or drop a plan during open enrollment. There are other special type of enrollment periods, but right now this is open enrollment for anyone on a Medicare beneficiary. You can look for plans for the upcoming year for the changes. And probably in the end of September, everyone who's a current beneficiary receives something from their plan saying these are the changes that are going to happen.
Yeah.
And then in mid-October, the Medicare.gov website goes live, and you're able to check all the plans on the Medicare.gov website by going through and answering many questions and picking your choices. Do need to tell you that in my county here, there are 24 different drug plans and 42 different Medicare Advantage plans, a cacophony of plans to go through. Every year, we do encourage people to come and talk with SHIIP or with their insurance agent to look at what's going to happen. I mean, you can have changes in your health, the medications that you take. Your physician may have changed networks. There are all sorts of things that change. So you got to keep on top of it. If not, come on to SHIIP or go to your insurance agent and talk with them. As you know, an insurance agent is only licensed to sell certain products. For example, and I'll be quick here, I had a friend who was a physician. He hadn't checked his plan in a long time. I saved him $100 $1,000 in 1 year. That's a lot of money to put back in your pocketbook. Thanks.
And this year I actually looked at mine as well, and I'm going to be saving over $600. So it does pay to look and see what's available. Now, besides having an agent, what's that website, the Medicare website again, where people can go to look at all of the possibilities?
It's called Medicare.gov.
Okay, so that's important. Now, you just mentioned people like agents. We're going to talk about fraud now. We're going to poke into the whole field of fraud. So the people that can enroll you are registered? I mean, what if somebody approaches you? How do you know if they're registered? How do you know if they're legitimate?
Okay. Well, as my dad used to say, I like to go to the horse's mouth, which is in the state of North Carolina and probably many states. That is your Department of Insurance. They're in every state. To be licensed as an agent, they have to be licensed. That list is available online through your Department of Insurance. It also provides a place where you can look for problems that any particular agent might have. But there are many, many agents. So what would happen if you walked into a big box store and there was a table there with information? There's a card there. You certainly would want to pick up that card and ask when they'd be back again, because then you have an opportunity to call that insurance company to find out. Or you can also call the North Carolina Department of Insurance if you live in North Carolina, of course. So,
yeah. And you know, in the big box stores, sometimes there's a person right at the table that's, you know, trying to attract you to come over to talk to them. So I don't know if they're agents or they're just trying to pass out the cards or what.
Sure. But you can check it yourself, or have a friend check it if you're not comfortable doing it on the computer. Have a friend check it. That's the important thing, is that you go to the source, however.
Right. Okay. Well, frauds of all types have grown just exponentially during COVID. I mean, they were certainly growing before that, but COVID just enabled the fraudsters to increase, I guess, because initially we were home so much and so forth. So in terms of Medicare, you mentioned, I think, abuse of the system, waste, just bureaucratic discrepancies and so forth. The Federal Trade Commission and other entities tracking Medicare have found out that there's at least $68 billion in fraud. $1 billion. That's a B. And so, you know, that's our money. And so who are these fraudsters?
Oh, Gretchen, unfortunately, they can be everywhere. But let me clarify a little bit. The 68 billion also includes the money wasted because of possibly human error, possibly double billing. So the 68 billion is a composite. Yes, fraud and abuse is the biggest one, but there's also human error and billing discrepancies involved with that. Agents have rules about what they can do and how they can communicate with you. If you find someone coming to your door and selling a product, that is not allowed. That is not allowed. They are also not allowed to call you as an agent unless you've called them or signed a little card or done something to initiate that. So just buyer beware. Buyer beware.
Well, I know some of the really big cases which we read about in the newspaper, these would be a a doctor who had billed and committed like $1.2 million of fraud, or assisted devices. We've gotten phone calls. I haven't gotten any in a long time, but that they knew I had pain, and they wanted to provide a knee brace for me. Things like that. So the really big guys. But what are some of the smaller cases? Not the $1 million cases, but some of the smaller ones. Have you got examples?
Okay, yeah, I sure do. I'm going to read from my list of examples here. Someone calls and claims to be from Medicare and says your Medicare number and credit card are needed to sign you up for health coverage. No, just hang up. I think that's the thing that people need to understand, is that someone who calls you out of the blue, you don't know them, you can't see them, it may be time to hang up. Another possible scam might be they call you and want you to sign up for Part D, as in dog. That's the prescription drug, the drug plan under original Medicare. They say you have to sign up or you'll lose Medicare. That's not true. That's not true. So hang up the phone. It's completely voluntary to purchase a drug plan. It has nothing to do with the rest of your coverage.
You know what I tell people, Elaine, is don't answer the phone. People, if it's important, they'll leave a message. And people can spoof when it says caller ID, and if it says Medicare, that doesn't mean it's Medicare. But basically, Medicare does not call you. They're busy doing all this other stuff. So, for those examples, yikes.
Exactly right. I have one that's an interest because of my background in healthcare. I've always had an interest in Medicare, and I've learned about upcoding. That's upcoding, not downcoding, upcoding. A code is something from an ICD book that has thousands and thousands of diagnoses, procedures, and other things in it. We're in the 10th volume of it this time.
What's the name of that book? ICD?
ICD-10. If anyone wants to learn more about that, they can just type ICD-10 into their search engine, and up comes the definition of upcoding. I'll give you an example. Say you are carried by an ambulance to a different place. You're charged for that, and you're charged for the mileage. Well, it might be 10 miles to the next place you're going to, but they put in 50 miles. They get paid more because they're traveled more according to what they've written down. So that's an example. I've had some little guy examples of billing errors. I was working with a client who had coverage by Medicare Original and a supplement, which kind of pays that 20%. She had Plan F, and that was paid for everything. She got a bill for $500. She called me. We went to work. The billing company says, oh no, she owes this money, and she was getting dunning letters. So I physically went to the hospital, and what had happened was that there was a billing error in that the billing department, which was not part of the hospital, it was contracted out, they forgot to send it to her supplement. So therefore she got a bill. So it's things like that that occur that are possibly human error. Had another one of my gentlemen, he had just moved to the area, and he was being billed and denied payment by a supplement for $1,500 because his procedure was not, quote, medically necessary. So I went to bat. We got all the records. Do you know what was not medically necessary? Putting in a pacemaker? A pacemaker is medically necessary. The doctor had not sent the right forms and had not sent the complete record. So those are some examples of little billing errors.
Well, there's a lot of other kinds of, I'm sure you've encountered or read about other kinds of fraud. Do you have more examples?
I sure do. I sure do. Let me get my list out here.
Yeah, get the list out, because these are kind of yummy. We need to know all these.
Goodness. Well, when you think about it, anytime someone else is paying a bill, you don't see that bill initially, but you do see it later. But phone calls about genetic testing, I've had that happen to me. Hospice, the palliative care program called hospice, there's even fraud going on in that. And that just broke my heart.
Oh, I think of those people as the angel on my shoulder.
Yeah.
Tell me more about that.
Well, when you look at hospice, you look at the doctor certifying that you have 6 months or less to live. If someone has your Medicare number and they're working with a physician, they can your medical identity could be stolen and certification done, and the money would be sent to the wrong place. It just breaks my heart because workers can steal things. Workers can steal identity. It's just too bad.
And the really scary part about that, Elaine, is then some of this information winds up in the dark web, and our personal information is bought and sold all of the time. So it's, you have to guard this information. This is critical information, and you must guard it because people can get it and they can even buy it.
Your example about the knee brace, yes, the durable medical equipment companies, when they send supplies to people's homes, me being a home care nurse, I would always count the supplies that came into the home and compare it to the receipt that they gave me. And quite often, or on occasion, there would be more or less. And so the providers really need to watch what they're receiving. That's about it for mine. Perhaps, Gretchen, you have more. If not, we can go on to the next one.
Well, okay. You've given some really good examples. So why can't Medicare just deny these claims? Or take the time to investigate them? Big deep breath.
Well, the claims, if you think about it, Medicare does deny claims. I've had some claims denied when I've looked at my Medicare summary notice, and I'll show you one of those in a bit. When I look at my Medicare summary notice or my receipt of what Medicare paid, there are little codes at the bottom of it that tell me, oh, this was a duplicate billing and they've already paid that. So Medicare does look at that kind of information somewhere along the huge process. It's a huge process to do claims. So they can deny, and they do catch some, but not all of them, and not the big ones. In my research, I was looking at the Kaiser Family Foundation and talking about why can't they investigate before paying them. Well, there are 37 million Medicare beneficiaries. That's the number of people. So each of us has 10, 15, 20, 200 claims in a year. That's a lot of work, and I doubt would ever happen. So it's up to you and I and everyone out there to really look at those receipts and to try to protect and detect those errors.
Yeah. So look at the date of service. What do you look for when you're looking at your you get it.
Okay.
You get a
Okay.
MSN, right?
Let me show you what I use, because I'm a detail person and of course interested in healthcare. I'm going to show you my Medicare summary notice. I'm going to put it up on the screen. I've blocked out my name and Medicare number because it's right there. And perhaps Gretchen, you'll be able to show us yours. A Medicare summary notice is not a bill. This is what it looks like. Let's see. Medicare summary notice. You see it says this is not a bill. This is a receipt, if you think about it. And it tells that I went to one hospital on October 12th, 2021. I pulled out an old one. I went to my dermatologist October 2021. I went to Ingalls Markets. Oh, that was my flu shot. Okay. So in the fall, I do a lot of my preventive things. So this will tell you where it went. And on the back is how to report fraud, how to get help with your questions. So this is really for people with original Medicare. Gretchen has something different to show, and that is called an explanation of benefits.
Right.
And these are done by Medicare Advantage plans. So that's what EOB means.
And this isn't, well, I can find out that I went to my primary care person, doctor. Let's see. I have to admit, this is really hard to read. And I've done a lot of work in Medicare, but I find these forms much harder to read than Elaine's forms are. But anyway, so it tells, at least I can match up the date and is it the right doctor?
Yeah.
And then my prescriptions, I can match those and say, is that what I really got, and so forth. So right. It's in here. So
I have something else too.
Yeah.
Yeah. I have a form that I made that anyone can make. It is just full of columns. So when I start my date, who I went to, what they did, and then when I get my Medicare summary notice, my MSN, what was the charge, and then if I have other supplemental insurances, I said, okay, have they paid yet, and what I'm supposed to pay. So it's like a chart. So SHIIP can help you with this. A friend can help you make one of these up, but it does depend on the type of insurance you have. So I find that handy. And then the Senior Medicare Patrol has this cute little personal healthcare journal. You can put all your health information in here, and it has a chart similar to what I developed, little pages and things like that. It's called the Personal Healthcare Journal. So this is my tracking. This is my tracking.
It's excellent. The details are important because back again, what was it, $68 billion, and we're the best advocates for watching the money in terms of ourselves. So I just wanted to tell you about one of my astute friends that she got her Medicare supplement, and it showed that it listed something that a company she didn't know, and she had no medical involvement with them. And she called the insurance company, and they said it was for a glucose test equipment and services. Well, she says, I don't have diabetes, and never ordered or received anything from the company. So apparently it had been rejected one time, and then it got refiled. Now, this is all things that she would never see. So they had her report it, and we'll give that number in a second. And that place then had her report it to the Office of the Inspector General. And so they were very appreciative and will be issuing her a new Medicare card with a new number. But these are why we need to look and take action. And I hate to say it, but very few people do take action. They put it in a shoebox or someplace or other.
Well, we can be the angel on your shoulders. We can reach out to AARP, reach out to Medicare. I just recently worked, in fact, this week with a lady who has some cognitive decline, and she has had 6 different plans in 10 months. So
6 different plans?
6 different healthcare plans in 10 months. So something is going on. We don't know yet what that is. It could be confusion. It could be family members are changing things because they're seeing things that look better on television. So I'm following that closely. I have a meeting with her hopefully next week in person, so we can see what's going on. So.
And you mentioned television. There's a lot of ads going on with celebrities talking about various ways you can get lots more money and so forth. And they don't tell you all the details.
No, they don't. They don't. And under some of the ads, you'll see little tiny writing that you're supposed to be able to read. You can't read that. You can't. Those, I call those hooks. It's a hook to hook you in to call and change it. And possibly this may be what this lady is doing.
Wow. Yeah. These are deep mysteries that you dig into. That's where your SHIIP volunteer is so important in your life and each of our lives. Yeah, exactly. So we've talked a little bit about how a person protects themselves and prevents loss of dollars, of the Medicare dollars. But what else can I do and all of the viewers do? What other things do you think we might do to report fraud?
Well, if you feel there's something unusual going on, go to the horse's mouth. And in this instance, it might be the provider. There could have been a billing error. You can also call the company that paid the bill. You can appeal that decision. You can call the Senior Medicare Patrol or SHIIP to help you with that, the SHIIP in your state. The Department of Insurance has these complaint programs available. Your AARP Fraud Watch Network, and I think there's going to be a number. There it is, just appears at the bottom of your screen, just like magic. And then, of course, 1-800-Medicare, 1-800-Medicare. So the reporting. So here's we've talked about prevent, detect, and so now report. That's the key. Even if you're not sure what it is, talk to somebody about it, because we can explore that for you. AARP can explore that for you.
Very important words. Well, I want to thank you, Elaine, for joining us today with this incredibly important topic, because fraud is rampant, and I can't think of any area where we don't have fraud now. But we really dug into Medicare, and I appreciate you taking the time to be with us today.
Thanks, Gretchen.
You're welcome. And join us again on November 16th, where we're going to be talking about veterans, because it's right by Veterans Day, and the fraud that's perpetrated against veterans. Believe it or not, veterans are more victimized by fraud than us civilians. Yeah. So tune in. There we go, and see what's going on with veterans, because if it's not you, there's probably somebody in your family that needs the information. So we'll wind up for today, but I thank you again, Elaine, and And it's just lots of energy for all the wonderful work you're doing to help people, because you are a good detective, I can tell. Thank you. Okay. Bye-bye.
Bye.